Do you suffer from a condition called transverse myelitis? There is a very painful and even crippling condition known as transverse myelitis, which affects possibly the arms and possibly the legs and possibly both arms and legs. That can lead to paralysis, which can lead to just painful, weakening experiences in the extremities, in the arms and legs. In this video, I'm going to share with you about a gentleman who came into my clinic, lives down here near my clinic in South Florida, and he was 39 years old, and he went from one day feeling okay to the next day not being able to use his legs. His legs, he could not stand up, and his arms became extremely weak. And he went into the hospital where the doctors did some various tests, including an MRI of his full spine and the brain. And they determined through various testing methods, including the MRI, it was not multiple sclerosis. And they gave him the diagnosis of transverse myelitis. And again, this was very acute because he went from one day okay to the next day not being able to stand up, falling on the floor, trying to get out of bed. And you know, we've got to understand with these conditions that there are causes of these conditions. Even though they told him and his wife in the hospital that this condition is an autoimmune disease, and this autoimmune disease is the body is just attacking, his immune system's attacking his spinal cord, and there's no apparent reason, and they can't figure it out. So their steps, their advice, their protocol to follow is to have some steroid type of anti-inflammatory immune suppressive medications provided to him, and doing physical therapy and doing some kind of aqua therapy. And I think if I remember correctly, he may have done acupuncture, I don't recall. So, but taking various supplements, including supplements like inositol and vitamin B12 and fish oils and probiotics and chlorella and bee pollen and so a number of things that he's done. And while he has had improvement in the function of his left arm, the right arm is still weak. The left arm is not perfect yet, but the right arm is weak, and his legs are extremely weak, and he's using a walker. Now, there are people who think there are doctors, there are physicians, there are websites, there are groups which promote an anti-inflammatory diet and doing some detoxing steps, which is possibly by taking supplements like pills or doing enemas or using a certain kind of machine to stimulate the nerves, like a PEMF machine, or maybe the electronic infection-killing Rife machine, or there are various methods that are proposed to people, or even doing electronic stimulation on the nerve. And so there are various methods that are proposed to people. Yet most often, all of these methods, the medical method, which has helped him gain back some function, but hasn't taken away what's causing his condition. While he has had some improvement, he still has the causes of his condition there in his body, damaging the tissue. So while they can reduce the immune activity against the spinal cord tissue and possibly anywhere else, like his myelin or his nerve, they're not stopping what will become the more will allow this disease to progress more. And what they're also not doing is they're not when they give immune suppressive medications and steroids, they're not giving the body a chance to defend itself if some other infection gets in. So again, let me explain to you again, this man, 39 years old, in my history taking, the way that I go through an evaluation, I figured out what caused his condition. I'm going to go over all of these different exam findings that I discovered with my very unique bioresonance testing. It's a manual. There's no electronic equipment involved. It's very accurate, precise, and will help people get well from their condition. Now, today I'm filming this video. It's about 6/18 or 6/17, June 17th exactly in 2016. And I met this patient with his wife on June 9th. This is 2 months after, approximately 2 months, maybe a little bit longer than 2 months after his initial transverse myelitis diagnosis and his initial presentation of falling on the floor, getting out of bed one day. So in the history, In my consultation with him, I discovered, and this may be similar for you, or there may be some other parts that brought on your chronic condition. In any event, this man, 39 years old, has a cold one week, just about 2 or 3 months ago. He has a cold, and he goes to the store, like any kind of drugstore, like a CVS. I'm not calling them anything bad, so there's nothing against CVS, but CVS or Walgreens or one of the local food shops, where he was able to obtain an over-the-counter stuffy head, fever, sinus, congestion, so you can sleep type of medication. I won't name the name of that med. He took this medication, and his cold, within a few days, subsided. About a day or two after the cold symptoms disappeared, he gets a very sore throat. And his sore throat, his wife looked in the back of his mouth with a flashlight, and she noticed that he had white spots all around the back of his mouth. So, like most people, he goes over to see his primary doctor on his insurance plan. And the primary doctor, the primary physician on his insurance plan, provides him with an antibiotic. The brand name is cephalosporin, and the generic name is I believe it's called Cefnidir or Ceftinir. I'll write that up on the screen. I'll find that here. It's Ceftinir, excuse me. So she provides him this antibiotic, and in a day or 2 days after he takes the dose of the antibiotic, he notices that his legs, his thigh muscles, his thighs, were extreme pain. They were in extreme pain. Just pain, burning, stabbing pain in his thigh muscles. So he goes back to the doctor, and the doctor prescribes him a muscle relaxer painkiller known as Percocet. He gets the generic form, if it comes that way, oxycodone. He has that prescription filled, and the prescription advice is 1 pill every 6 hours. So he takes the pill along with the antibiotic, and he notices that the pain reduces, not eliminated completely, but the pain is reduced for the first 3 hours after he takes the oxycodone, and for the second 3 hours, within that 6-hour window, he notices that the pain comes back just as severe as it was before he took the pill. So he takes another pill, and he goes over this course of action for a couple of days, still with the antibiotic being used. And then by about day 3 with the oxycodone, he notices that the pain is not reducing, so he goes back. It was either to the primary care doctor or to the hospital, and he gets the prescription, or the physician who evaluated him and listened to his concerns and his complaints and his pain, doubled the dose of the oxycodone medication. So he goes back home and he takes the double dose. So instead of, let's say, 5 milligrams one every 6 hours, it's 10 milligrams per a 6-hour period. And he wakes up the very next day after getting this double dosage, double strength prescription that he consumed of the oxycodone. He wakes up the next day and he tells me this: my legs did not hurt. A little bit of sensory change in my left thigh. There was a little something that was going on. He couldn't describe it. It wasn't like a burning, it wasn't stabbing, but it was definitely a different sense in the left thigh. The right thigh, he felt no problem. He laid in bed feeling relief. Thank God my legs are not hurting the way they were. He was so grateful. He turns in the bed to get up and puts his legs on the floor, and he goes to stand, and his legs give out and he falls on the floor. He then goes to get up, and his arms are extremely weak. With his wife's help, he could barely get into the kitchen, barely get into the bathroom. They go to the hospital. Hospital runs an MRI. Hospital runs different tests, a blood test. They don't find anything wrong in the blood, and the MRI shows that there's inflammation in his spinal cord, and they start with medication, and he was in the hospital for 2 weeks. And So now, as I told you in the beginning, the arms came back to some function with some physical therapy over some time and the steroids that they have him on, but they have not figured it out. They have not figured out what caused his condition, which I'm going to share with you here, and how to fix him. So his legs are still extremely weak, and he just doesn't feel normal. Doesn't feel the way that he felt 3 months ago. So we get into examination, and during the consultation, actually, I had his wife go back home and bring in the medications, the over-the-counter and prescription medications that he had taken. And because it just makes sense, listen, it's not that he ate gluten or dairy and had a slow progression of this problem. It wasn't that he ate a food and then his legs became paralyzed and his arms became paralyzed. Something else happened. He didn't change his diet. There was no food poisoning. There was no other stressor. It wasn't about a gluten or a dairy or a food reaction. Now, let me just clear something up again about what I mentioned earlier, because I'm going to tell you towards the end of this video what I found is that after about 3 days or 4 days, I believe there was no more antibiotic used, and his sore throat went away, and the white spots on the back of his mouth disappeared. Okay? So that seemingly was that the infection was gone. In my examination, and I had his wife get all these medications and bring them into the office, and in the next hour, hour and a half that I engaged in examining this patient with my method, I found that this over-the-counter toxic chemical, the active ingredient that's in this over-the-counter stuffy head fever so you can rest type of medication, and I won't name the name, and it isn't the exact name of that label that you might be thinking of by using those key terms, but it's the same kind of over-the-counter medication, and it's got a different label on it. Well, I found that over-the-counter toxic active agent was the key, the first key in the puzzle of finding out why his spinal cord became so malfunctioning. Let me tell you something. And I found this in the anterior part of his spinal cord. No, there was no biopsy. I have a very unique system. In my clinic, I have vials that have tissues, diluted tissue samples, down to, they're marked with a label of every single tissue sample. The spinal cord posterior, the spinal cord anterior, the lateral spinal cord, different parts of the brain, different parts of the brainstem, different nerves, different cranial nerves in the body, the spinal fluid, the myelin. I have samples of these and many other tissues of the human body that I can study through a very unique stress reflex system. I also have samples of all different kinds of toxic chemicals, antibiotics, which are a big cause of disease in the body as well. I'll get into that more later. And while somebody may choose to take an antibiotic for the sore throat, it's not the only way to handle the sore throat by a strep. But I will say this, if you've taken it and it's already done, this is where I'm going, is that we've got to find out what's causing your transverse myelitis or your other kind of strange disease in your body, strange autoimmune, crippling disease, painful disease in your body. So I've got all different kinds of pesticide poisons, herbicide poisons, and heavy metals, and mercury compounds, anesthesia chemicals, and bacteria and parasites and Lyme infection and co-infections with Lyme and viruses and vaccine agents, and I've got mold and fungi. I've got all samples of all these different type of stressors that can actually invade the body and cause poisoning and infection and inflammation that will break the body down. And that's what I'm telling you is going on in the body, is that the immune system is attacking the infection and or the toxin that's in the tissue. It's doing its job. Your immune system is not stupid. Your immune system is trying to get rid of the poison and the infection that's on the tissue. So I found that this over-the-counter coffee, stuffy head, sinus kind of medication was in the spinal cord, anterior part of the spinal cord. I found that cephalosporin antibiotic was causing damaging side effects, inflammatory side effects in his anterior spinal cord. And listen, this happened just after he took the antibiotic, burning pain in the thighs he'd never had before. Took the antibiotic with the Percocet, and then he crippled with pain. So what do you think caused it? Gluten? No. I also found the oxycodone, painkiller reliever medication in the anterior part of his spinal cord. I found other kinds of antibiotics like Cipro in his anterior part of his spinal cord. I found two kinds of candida in the anterior part of his spinal cord, which are Candida albicans and Candida tropicalis. I also found the MRI contrast the dye that they put in. Now, they didn't do the MRI, but they did the CT scan to try to find what was going on. So the same kind of dye that would be used in a CT scan, used in MRI, I have samples of that I can test the body with and find if it's in a specific tissue with precision, with accuracy. I also found that he had the strep infection inside his anterior part of his spinal cord. Let me pause there because he had other kinds of, there's different individual specific streptococcus bacteria. So I found several different individual streptococcus, I don't have to name each one here, but individual streptococcus bacteria inside his anterior part of his spinal cord. The anterior part of the spinal cord is very important because that part of your spinal cord is what drives motor movements. That's what makes your legs walking, your arms moving, your fingers working, your toes move. That's what allows your body's motor functions to take place, because the motor driving nerve cells are located in the anterior part of your spinal cord. The posterior spinal cord does something else. It's where all the sensation, all the sensory going up to the brain is going up the back part of your spinal cord. So the spinal cord is in the back of your back of your body. It's in the spinal column, in the vertebrae, and the anterior spinal cord, motor, posterior, sensory. It's how your brain gets to feel. If you step on a tack, that sensory signal goes up the back of the spinal cord up to the brain. The lateral spinal cord is the area of the spinal cord which allows your body, it's the sympathetic in the mid-back part of the, let's say the lowest part of the neck to maybe the upper part of the low back, the lumbar spine. You have the sympathetic nervous system in the lateral part of the spinal cord, and that helps to change systems. Like if you're going to run for your life or fight off somebody attacking you, the lateral spinal cord has these signals that go out to the body that will make your heart rate go up. It will slow down your digestion. This is one of the causes of chronic constipation in people, is infection and/or toxin in the lateral spinal cord, because it's turned off the intestinal function. It turns up the heart rate. It can make you sweat more. People have sweating, chronic sweating problems. They're always moist. It can be from a problem that's in the lateral spinal cord. So let's go a little further. In addition to the strep infections that I mentioned just a few minutes ago, he also had parasitic flukes, which I found in the anterior part of his spinal cord. He also had causing damage to the anterior spinal cord, causing inflammation, causing pain, causing weakness of his extremities. He had the Lyme infection, the Borrelia burgdorferi bacteria, Lyme infection in his anterior part of his spinal cord. I further went down tissues in an order of importance to be able to figure out what's going on in an order of priority. What's tissue number 1? What's tissue number 2? What's tissue number 3? When we're in tissue number 1, my system, I'll be able to find out what's in a precision and a accurate order of priority. What is infection or toxin number 1 in that tissue number 1? What's infection or toxin number 2 that we need to deal with, that your body wants dealt with in number 2 order? What's infection or toxin in number 3 and 4 and maybe 5, maybe 25 in that first degenerative tissue? Once we can close that and figure out everything that's in there that your body can go along in a timely manner to eliminate with these specific remedies that I create for you, you will be able to then, your body then says, I can have enough strength to go into degenerative tissue number 2, or I'm done and that's all I can handle. There's too much work for me. I'll explain that more when we get into a consultation with you. But in his tissue number 2, in order of importance, priority tissue number 1, anterior spinal cord. Priority tissue number 2 was the motor neuron. The motor neuron disease is something like what you're probably familiar with if you've ever heard the term Lou Gehrig's disease. Now, Lou Gehrig's disease, or ALS is a disease of the motor neuron. Now, your motor neurons exist in the motor part of the spinal cord, in the anterior spinal cord. The motor neurons we have elsewhere in the brainstem. So through the different areas of the nervous system, you're going to find motor neurons. Now, these motor neurons receive signals from the brain, And like an air traffic controller, receiving the signal and directing a plane what to do in the airport on the runway, well, we receive a signal from the brain and the motor neuron, and then the cell has a nerve fiber that comes out of it, which then goes, let's say, to your heart to tell it how to function, or it goes to your arm to tell you how to lift, it goes to the shoulder muscle, or it goes to the bicep, or it goes to the tricep, or it goes to your thigh muscle, it goes to your back muscle, or your abdominal muscle, or your stomach to tell it how to digest, or your intestines, or your thyroid, or your arteries, or your aorta. Your motor neuron is vital, to helping your body function the way it's supposed to function. Now, when an infection and or a toxin, or a list of infections and or toxins, and even electrical stresses, electricity from cell phone radiation and Wi-Fi signals and cell phone towers, and your car, your electric vehicle, your tablet, your laptop, your desktop computer, when these electronic devices, along with infections and toxins, invade the energy of those electronic devices, and these infections and toxins invade the motor neuron, then you're going to get a motor neuron disease, a motor neuron malfunction, which means you may lose the ability to tell your heart how to function right. It may function too fast or too slow. You may have a problem with low blood pressure or high blood pressure. You may have a problem with constipation. You may have a problem with not being able to move your arms or legs, whether it's called ALS, or it's called something else like transverse myelitis, or it's called something else. You can have weakness that develops in your limbs because your motor neuron has gotten infected. And now, let me give you a little further tip, is that the motor neuron has a nerve fiber that goes to, let's say, the heart and the mitral valve and the aorta and your kidney, and it tells your arm how to move, and it tells your leg how to walk. It tells your back muscles how to work. It tells your neck muscles how to work. That motor neuron, the nerve that comes out of it, has a covering called myelin, the myelin sheath. Okay? So just so you're a little more familiar, you need that myelin, that covering of the nerve, so that the nerve can actually carry the signal from this conductor cell over to the organ, the muscle. Okay? When the myelin disappears because of some eroding factors in the body, some poison, some toxins, some inflammatory immune process, some infections that get on that myelin and deteriorate the myelin, the nerve will be there, but the covering is not there, so the nerve can't fire the signal over to the muscle and tell your arm how to move anymore. So in his myelin, in his motor neuron, I found more of residues of the over-the-counter coughing, stuffy head, sinus, so you can rest type medication. I also found a very high level of the antibiotic cephalosporin damaging his motor neuron. Further on in examination, the myelin sheath came up, and I was able to listen to that myelin sheath, like taking a biopsy of it and sending it off to all these different laboratories and saying, Laboratory 1, look for mercury. Laboratory 2, look for pesticides. Laboratory number 3, look for all other heavy metals. Laboratory number 4, look for any fungi. Laboratory 5, look for any mold. Laboratory 6, look for any kind of bacteria that's on that myelin. Laboratory 7, look for any kind of parasites that have infected it. Laboratory 8, look for viruses. Laboratory 9, look for toxic household chemicals. Laboratory 10, look for medications over the counter prescription. Within minutes, I'm able to do this and find what is causing the damage to the tissue, in any tissue in your body. In this case, with the myelin, the cephalosporin was the active ingredient, the invading ingredient, the cause of the inflammation, causing the immune system to attack the chemical that's gotten onto his myelin. That has to be removed. There is a journal, I'm going to put the name of this British Journal of Pharmacology on the screen. You have a right to learn what your doctors and the television is not telling you. Antibiotics have been linked to seizures. Antibiotics have been linked to Tourette's syndrome. Antibiotics are linked to tic disorders. Antibiotics have been linked to causing peripheral neuropathy. Antibiotics were in one of these studies, they found the antibiotics caused the seizures so fast, within a day after prescribing the antibiotic, within 2 or 3 days, I believe it was, if I remember correctly, they had to stop the test because they couldn't stop the seizure. The antibiotic caused the seizure. Number 5, they found an antibiotic in a rodent, in a rabbit. They found the antibiotic caused, on MRI studies, the antibiotic caused white lesions in the brainstem of the test subjects. They looked at the nervous tissue before they ran the antibiotic study, and then after they provided the antibiotic to the rabbit and so on, and they found white lesions, brain lesions. Multiple sclerosis, an incurable condition. They don't know why, they don't know how. And in this study they found antibiotics caused the white lesions. You deserve to know what you're putting in your body for a yeast infection, for a vaginal infection, for a urinary tract infection, for strep throat. You deserve to know and have a better education, and don't just listen to the doctor who just takes out the pen and says, here's your prescription. And you don't know, so you just take your amoxicillin, your penicillin, your tetracycline. You look into this journal I'm going to put on the screen now. Again, I'll show it. You need to know what's going on with these dangerous antibiotics that are being put into your system. Myelin sheath had the pernicious agent cephalosporin. Then at the end of this exam, I checked his tonsils. I did not take a biopsy. I have samples here in my office, in my clinic, and I'm able to do the stress reflex and find what's in that tissue. When I put the vial of the tonsils on the tray that you're connected to without electricity, when we get a stress response by the body, I know there's something wrong. I'm not going to get deeper into that discussion right now, but when I find stress from the tonsils, I got to find what's causing the stress. Guess what was the one and only stress factor within his tonsils? Take a wild guess. It was Streptococcus bacteria infections and multiple different strains of Streptococcus infection in his tonsils. Guess what? The antibiotic, which took away the white spots in the back of his mouth, the antibiotic which caused the pain in his legs, the antibiotic never killed the strep infection in his tonsils. So let's just say that he never had the leg problem that developed. And let's just say he all of this rest of the story never occurred in his life. But he took the antibiotic and his sore throat went away. He's happy. He thinks everything is fine. He goes off without a symptom. Everything's fine. But the strep infection was still there, and it did not all die off. And it was actually a very large amount of infection. It did not all die off from the antibiotic. Maybe the antibiotic cut through some of it, but it did not get rid of it all. So don't be fooled that just because you don't have a symptom, that everything is okay. Now, I provided him his protocol this week. I will be checking back in with you with another video titled something along the lines of transverse myelitis, so you can keep in touch and know what's going on here. I will tell you about his results. There are no other treatments that he's going to do. The supplements we stopped. They're not giving him improvement. He has plateaued. He told me he plateaued. He is stuck in a certain place after the physical therapy and the medication and the immunosuppressive and the diet and so on and the supplements. He's stuck. So now we have to change the protocol. We have to change the step. And what I've done is make up remedies on following a homeopathic understanding of like cures like. I'm not here to cure anything. His body's going to do the job on its own. But homeopathy's understanding is like cures like. We have the ability to test a single tissue and find out what's in there and make remedies out of them, identical copy remedies of the spinal cord anterior with that medication. That it's going to destroy, it's going to remove, eliminate, safely and elegantly remove that medication from the tissue. It's going to help patch up the tissue of the spine. And I will report back to you as soon as I get to see him again, which his protocol will last 29 days. Okay? Listen, like me on my Facebook page. Very quick and simple. I share information there all the time. Useful, very unique understanding and shares of what causes chronic disease and about reversing these chronic inflammatory autoimmune conditions. Autoimmune, your body is not stupid, just attacking itself. Subscribe on my YouTube channel. Subscribe. You'll be the first to know when I put up new videos. You'll get an email, you'll get a message when I put up new videos. And these videos are chock full of great information, different information. And scroll down and see that I've got many different videos of many different topics. There are things about the blood, there are things about headaches and chronic fatigue and MS and so look around, lupus, look around on my YouTube channel. I've got at this point over 180 videos on my channel. And share this video with just one friend, just one person. It's very simple to take your phone and press a share button. Send it to another person, send it to their email. Very simple. You're helping another person who can and needs to get well when they have the right methods that can help them fix their problem. Okay? Call my clinic. For those who are ready to make an appointment, call my clinic at 954-370-3100. Again, 954-370-3100. Call my clinic and you will be greeted by a very lovely assistant who helps schedule these appointments. She is not here to answer other questions really. She doesn't know everything that I have to do and say and do and to figure you out. We'll cover that in a consultation. Medicare, Medicaid, workers' comp, other insurance policies do not cover my work. This is very unique work. They don't have any insurance coding. There is no way for me to bill. We don't bill the insurance for you, and I cannot help you get reimbursed. This is unique work, and it doesn't work another way. So this is out of pocket. Okay, so when you call, just be prepared to provide us information of what we're going to get. Great detailed information. There's a small packet of information that we're going to send you, questionnaire form that you're going to fill out, and write a diary of other things that you can think of, and be prepared for a very in-depth consultation, looking for what's caused the triggers and getting involved in the examination. The consultation will bring me to the next step, which is the exam, and get you the answers that you're looking for. Okay? Again, call my clinic, 954-370-3100.